As a this thing, today's my program, today's my talk. I'm going to talk about computer tomography, their principle and techniques. As all of you know, I'm Mr. Sheety, working as assistant professor in KSAGD Medical Academy under the NITI deemed to be University from Mangalore and Karnataka. So, as all of you know that once the once the CT is came to the world, you know, there's Sir Godfrey Newbold Hounsfield, who April 7, 1972, he announced the invention of computer tomography, where he presented that in annual congress of the British Institute of Radiology, one of the biggest radiology journal in the world. Who he presented in that. Later, as all of you know, that in 1963, previous itself only that Comac in South Africa, he developed the algorithm for the reconstruction and all. But later, when he Hounsfield, when he developed the CT, they both have worked together. Because of that, they both of them got Nobel Prize in 1979. So later in 1974, where Sir Godfrey Hounsfield, he developed a prototype CT scanner and did the picture. So as of, I think I already mentioned before, come to the CT, X-ray was a very popular. Later, because X-ray is the 2D, is a 2D image where X-ray attenuation is particularly efficient in bone and in the soft tissue. Better when CT image developed, we started getting a 3D image. So 3D image where we'll get the high resolution of the images. It shows the various soft tissue organs, bones, inner slice or cross-sectional image, we able to see it. So where it is basically, it started with the tomography. It was previously, before CT invent, it was used where used to use a X-ray tube and film used to do the tomography. But later that same similar technique, it become a CT. What is the CT principle? The internal structure of an object can be reconstructed from multiple projection of that object. That's the most important, the principle of the CT. The internal structure of an object can be reconstructed from multiple projections of that object. So that's a principle. So how the principles of the basic equation is used as the transmitted intensity is equals to the incident intensity of an X-ray beam, where multiplies the Lewis constant, and where is increased with the linear attenuation coefficient and the thickness of the object. These are the basic equation where it's used to develop the CT basics, CT principle. So before I go into the little bit small, I'll not much explain about matrix, pixel, oxel, and all. Already all of you know very well about when you are in an Android world. Definitely you know very well about it. So is a matrix is the whole actually is created a CT actually is made up of the whole image. One image is a matrix. In that 80 into 80, 160 to 160, now 1024 to the 1024 or 512 to 512. Most of the places when we do a high resolution CT and all, we will use it. The pixel is just a point, is a small element of the matrix. That's we called a pixel, because this all matrix, pixel, oxel is most important part. It will take place in the developing the CT. And the voxel is the where tiny elongated block of tissue, I mean volume of element, volume of the pixel is the voxel. So that's where it will decide, where it will create it will tell us what is the slice thickness, what is the tissue slice thickness of the this thing. That's the most important in the slice imaging. So what is CT number? CT number is the linear attenuation coefficient of each pixel, where computer calculates a value for the linear attenuation coefficient of each pixel, and that value will convert to new number. That's called a CT number. So that CT number obtained from the magnified different constant, what we call the Hounsfield scale, is that name is kept to honor the inventor of the CT. That's why we called it now, that's Hounsfield unit, HU. Free in a short form we call it HU. So when initially, when originally EMI scanner, which is the first generation, when it was the number was the 500. Later, now whichever is using it presently is with the 1000. CT number is 1000. So you can see here, this is the scale. You can see the different scale which is present here. Now when zero will be water. The 0 to 30 we usually is called as a fluid, water, all those things. The above than that, slowly it will change in the sense, it will might be a kidney, might be a pancreas. You can see that kidney around comes into 20 to 40, and pancreas, if it is the value of the HU, will be 30 to 50. The blood will be 50 to 60. That where we use when we get a cerebral brain CT. If anything hemorrhage or anything is there, we will see the value that is 50 to 60. But upon that, we able to make out is acute or is a chronic bleeding. Then same time, that's as that is the part of the from the 0 to 1000 is a plus 1000. So that is what CT number, which is 1000, closer to the 1000 is bone, what we call. And at the same time, if you take it in a other side, in the negative side, so that's, you can see usually fat will be 80 to 100, where minus 80 to 100, where the lung, when we see the lung, you can see is minus 500 to minus 1000, where we use it for the chest, or sometime when we want to see the air and all, this is the Hounsfield. So whenever you use a region of interest in the CT, you are able to get all values, HU values of the each part of the body in a cross-sectional image. So when it comes to the window width, the window width is the absorption measures range in CT, which is expressed in a Hounsfield unit, is called a window width. CT number range from 1000 plus 1000 is a bone to minus 1000 is the air. Already explained you people. It means window width is 2000. Where in window level, when the center or midpoint range of CT number is a window level. Example, you take a look here. Window width is 200 and window level is 0. How is the CT number greater than the plus 100 and less than the 1100? It becomes a 0. At the same time, you take that another, might be sometime brain or abdomen part. Window width is a 200 and window level will be 40. So the window level will be 40, because the CT number greater than plus 140 appears white, where CT number less than the minus 60 appears black. So when we calculate, the window level will be a 40. It means it's the center point of the window level. So this is all the basics of the CT. I think all of you, I hope that you understood. If you because this is the in a short period, I'll not able to explain it briefly because I need to cover a lot of part in many slides. Somewhere I have added many images or pictures and all. I may not be explaining that, but please go through that later. So particularly on that slide, and you can read it and you can understand it. So I further will go to the generation. The first generation of the CT, whereas I already told you that EMI, which is first generation of the scanner, is EMI electrical and musical industry, which is where parallel beam geometry is used, where data acquisition based on translate and rotate motion. X-ray beam is highly collimated with the pencil-like beam, because after that translation tube and detector rotate at 1 degree. So we used to repeat 180 degree. Once it goes again, it will come back to the zero. Again, it will start with the 180. So usually it will take for one movement. It will take 4 to 5 minutes. So if you want to get the one complete one this thing, they used to take 25 to 30 minutes. That's why it was in the this thing. You can see this is the image here where CT EMI, the first scanner which was installed in the 1972. Later you can see here, this is uh, the first image matrix which we used with the 80 into 80 matrix. You can see, you can just imagine how when it was developed, the first generation of the CT, and at present what we using it, it will be drastically changed. Now every single point of information we able to make out due to the improvement in the CT field. So what are the disadvantages? I already told, scan time is more, only head scan it was. So you can see this is the uh, animated image. You can see this how image was creating, how the tube and how detector was moving. It was, I already told you, that was used a pencil beam for to create where pencil beam is very pointed collimator it used, and it will penetrate to the detector. Then next comes to the second generation of the CT, where it is translate rotate. The previously was rotate and translate and rotate with the multiple detector was used. Is here what they there in previously it was used a pencil beam. Here which used a fan beam geometry was used, where data acquisition based on translate rotate motion, and is multiple pencil beam motive used, where usually 30 detector there in the previous single first generation it was a single detector used. Here 30 detector used, where 30-degree rotation, when it comes to 180-degree it will be repeated. So usually 22 the whole scan able to finish in 20 to 20 seconds to within 3.5 minutes. You can see here, this is the image where how the image was created. There is a X-ray tube and a detector is moving at the same time, translate and rotate motion. Where detector was again, it was changed, sodium iodide centralized detector used, but only the disadvantage was very complex. It's very difficult, very lot of complexity was therein. So later come to the third generation was where it came to the picture, where when it is the third generation came to the research, the everything CT, the field is everything is changed. That entirely everything is changed because of where it is used with the slip ring technology, where it's used from the third generation. After that, everything able to, where in the previous two generation we able to move 180-degree and it has to come back because there was no slip ring technology. That's in further next slide I will be explain. So where X-ray tube able to move 360-degree, and around 200 700 different detector was used. So 1 second was enough to take one rotation of the scan. So that's a very short time we able to get the this thing. So limited artifacts where respiratory motion or those things and all, it was very less. Later xenon and scintillation detector also used in that. arc of detector is used. That was the it is taken place in the third generation. What are the disadvantages? Only that ring artifact. Even though nowadays also we used to get a ring artifact, but still it's not a big issue. There are a lot of where we can correct nowadays. You can see this is the image which I'm just kept the inside of the CT gantry. What and you able to see it? You can see this is the tube, X-ray tube. This is the X-ray tube, and here these are the detector. These are the detector is present here, and these are other where it will take rotation in a 360 in this directions in these directions. So how the CT developed, you can make it. I think most of them you might have seen this images in most of the places. So next comes to the fourth generation where rotate and fixed detector it was used. In a previously detector and X-ray tube moving together. So rotate, and fourth generation rotate and fixed. X-ray tube will rotate, detector will be fixed. So that's what the which is in the fourth generation, where a sodium iodide scintillation detector, couple of multiple photo multiply tube PMT photo multiply tube is used. It's very scan time is very short because rotation only X-ray tube it will rotate. There will be more accuracy this thing and all, but disadvantages was very costly because fixed detector means you had to the whole 360-degree of the CT gantry you're supposed to fix with the detector is very expensive. So another thing, geometry of the requires of the detector space further is very it was complicated. So rejection of scattered, less efficiency, sensitivity of contrast may be lost because the the 360-degree of the detector which is fixed, because of that the scattered used to absorbed by the detector, the sensitivity of the contrast or image where it was creating a fog. So that's why not much developed in the later. Again fifth generation came, we also called EBCT, electron beam CT, where is electron beam is used to create the X-ray but is very is 10 times faster than the conventional other all the more generation of the CT, where electron gun generated 130 keV electron beam it was used. The detector usually all which is solid state detector which is consists of luminant crystal cadmium target which is used, where in CT number here I told you in first generation it was a 500, later all it was 1000, here minus 1000 to plus 3000 which was, you can see the image. This is like how it was working, this is the whole it was it's like a whole thing was a see X-ray tube, how X-ray inside the X-ray tube whatever the from the cathode to anode how electron was hitting, the same thing with his whole CT mission was it was creating in that way. So here you can see this is the uh, electron gun was there, when electron guns all produce the electrons, and this focusing cup it will direct to target here in the target, and here CT patient will be lying down, this is the head example, it will be lying down, and when this electron hit to the target ring it will reflect back and it will go in this direction and it will hit to the detector ring. Okay, it means from when the target ring is here, so when target ring hit by the electrons it will divert and it will pass through the part of the patient body and it will hit to the detector, and here is the detector, what it will does, it will collect the information and it will convert those invisible information, it will convert to visible information. But there uh, very complexity was there in the sense very expensive. It was the image quality, those things and all, it was not so good. That's why that was not developed. Later, sixth generation CT came, where here working principle everything almost same like third and fourth and all, but only here there are dual source CT scan used. It means two different CT X-ray CT tubes are used. Here is the one X-ray tube. Here is the second X-ray tube which is used. It will simultaneously rotate around the patient. So where it will be kept at the angle of 90 degree each other. So that's what where it was gantry rotation was one of the shortest gantry rotation, because due both tubes was there. So within a 0.33 milliseconds we able to rotate. Later, which is seventh generation, still in at present still in development, where uh, this the used flat panel detector, digital detector, where it is used. And previous all the model generation you seen that it was scintillator detector, different cadmium, all those things it was used. But here in the seventh generation, where flat panel detector used, where cesium iodide, amorphous silicon, thin film transit which is used at presently, all those things which is used in the it is used in the uh, digital radiography DR system. If you are well know with the DR digital radiography, so the same thing which is how flat panel detector is this thing. But what the benefit of this excellent spatial resolution was there. So but the only thing was lack of good, and it is still is in process, development process. Later, this all the different generation what you are understood about with the different kind of images. Then what is the benefit of the helical seat? Permit new option in reconstruction, where acquisition is entire volume data collected during entire scan, where revolutions what has happened 360-degree rotation in X-ray tube in a single acquisition. That was the it is started from the third generation, whereas pitch distance of the coach travels during a 360-degree rotation X-ray tube, that was which is introduced later, which is pitch is one of the important factors, where faster the scan as well as the resolution, contrast, all those things, one of the important factors is the pitch. Next we come to the slip ring technology. Slip ring technology, I already told you that is which is in a third generation of the CT, which is slip ring technology we bought. So after that, that is entirely which is changed. So what is the slip ring technology? Electromechanical device that transmit electrical energy across a rotating interface. It means when something is rotating around it, means you no need to have the wire to rotate that ring. So that is used with the different two types of different components to give energy continuously to that ring, and it will allow to rotate. So allow the X-ray tube and detector rotate continuously, allowing very fast collectioning of the data. So that's what is the benefit of the slip ring technology. So what are the types of the slip ring technology? There are two types of slip ring. One is uh, types of the slip ring technology means the type of the providing energy to the slip ring. So that is a disc. Another one is cylinder type. So that will be briefly it will be explained in a further slide. So as I told you, there are two types of slip ring technologies there. One is low voltage. You can see this is the where AC. The first here with the low voltage, what will happen? With the first is the AC, then second is the slip ring, and then it will go to the third is the gantry, which is third is the gantry, where this AC it will give high voltage generator to the then it to the X-ray tube. But high voltage, where in high voltage slightly change, where AC it will give power to the high generator, then it will give to the slip ring, then it will to the X-ray tube. So that's what the other type. So these are the two type of slip ring technology, which is I already explained. This different, where AC delivers power to the high voltage generator, then that high voltage generator it will give to the slip ring, then it will, from the slip ring it will go to the, that depends on the company, they will different type of this thing will be used. So that I already told you that brush which is giving supply to the there are two types, wire brushes and the composite brushes. So this, there are two types of this thing, it will give energy to the slip ring. You can see here. Now this is a wire brush in the sense you can see in the image. Go see, please see in the image. You can see this is here. There are different are there. Okay. So that slide is already moved. Is not, I am not able to go back. There are this is the example slip ring. You can see in the image. This is the slip ring. So these are the three brushes. What will happen when the slip ring rotates in this way, 360-degree, it is continuously rotate. These three different wires, it will touch continuously. It will give energy to the slip ring. So that's what in the that the first one. Another one is composite brush, where in composite brush, where a conductive material which is sliding contact is, and means it's continuously like in this way continuously. In previously it was a wire type brushes, where this is the ring and this is the wire, it was touching in this way continuously when this slip ring rotates. So here, where in the composite brushes, it's continuously, it gives supplies like in this direction. So that is what, how there are two types of slip ring technologies used. You can see this is the, because of the slip ring technology, we able to, you can see in the image, animated image, it was able to get the continuous rotation, 360-degree rotation without any interruption. So what is the benefit of that? uh, I told you already, facilitates continuous rotation of X-ray tube, volume data can be acquired quickly, faster scan time, and no start stop process is required. So this is all cable, everything is reduced due to this slip ring. So next we'll go to the, what are the different multi-slice CT. See, there are, in conventional CT there are 4 steps, which start with the tube and detector are accelerate to constant speed. Then second step where X-ray tube energized by the data collecting for 360-degree. Then in a third step is tube and detector slowly down, because after the completion of collecting the data from the patient, X-ray is passing through the patient and it will hit to the detector and collecting the data. Then third step will stop. In the fourth step will be where process scanning, those things is process, everything start. So here you can see how conventional CT it was started. When here you can see in the image, see now example, this is the one rotation. Once one rotation is there, you'll ask the patient to hold the breath and you'll take another rotation. Then again it will ask you to hold the breath and you will take a third image. Then again after breath hold, again fourth image. It was with the, this is the time. If it is, if you are keeping one slice to another slice, the time gap, if it is 1 second, example I'm giving, it is not 1 second. This is depends on the slide speed and the pitch, and depends on that anyway. So first slides, one after one slide, hold breathing, breathing, you will ask the patient to hold the breath, and second and third as on. continuously it will be taken place. But in later CT it is completely changed. So how this was a conventional CT. When spiral CT introduced, everything, the technique, everything is changed. So where I can see one of the German scientist, Dr. Kalender, in 1998, he started working on spiral CT in the Switzerland, and 1989, where he produced his technique in RSNA. I already told you, one of the biggest journal in the. So where it was spiral CT, it is continuously scanning able to get the shorter time and image reconstruction in any portion along with the z-axis. Slice can be overlap or spaced away. Coach must move with the constant speed. Coach means, I told you, that is related to pitch, table movement, then data acquisition, all those things where we later post processing or pre processing, this thing, it was used with the image reconstruction with the filtered back projection. That was where it used the blur or all the image motions. That was how developed. See now, I previous in conventional, what was happening, once the patient hold the breath, you are able to get a one image. But in a spiral CT, once the patient hold the breath, you are able to get many images in a one single breath hold. You can see here in the image itself only, we are able to get 6 different images in a single breath hold. That was which is developed in the spiral CT. So in spiral CT, there will be 2 different types: single slice CT and multi. But single slice CT now, I don't think anywhere it is there in the India or in the anywhere, because everywhere it is familiar with the multi slice CT. So what is the single slice? This thing, longer acquisition time, tube rotation, and coach moves continuously. X-ray tube always on rotation. Instead of it's like one slice, one is scans volume. So where in multi-slice, multiple slices with the volume. So less, it covers the lesser area. So if you wanted to scan, example, one heart means heart area, cardiac CT example, you need to get many rotation. But wherein here nowadays we have so many, now 128 to now it is reached to 720 and all, where we able to get in one rotation itself only we whole of the heart scan. Multi-detector, which is used in 1998, where after introducing multi-detector, everything changed. Everything what we used with getting images nowadays with the multi-detector. So what helped the development of the multi-detector? High heat loading capacity in the X-ray tube, that was development after the multi-detector. Multi-detector technology is introduced. Dual focal spot technology is introduced. Fast reconstruction algorithm it is used. Because of these 4 factors, to get the multi-detector CT. So what are the single comparison with the single slice and multi-say? I already explained you: detector configuration, reconstruction technique, pitch, and image quality, where is entirely changed. You can see in the image where with the single slice CT, here you can see you able to get one single slice, single narrow length single detector with the z axis, where in the multi slice detector, where it is, which is, you can see there are array of segment which is in a z axis. So that is what benefit which is in the compare with the single slice and the multi slice. You can see this is the reconstruction how it is developed in the single slice and the multi slice CT. So as I told you previously, pitch is one of the important factors where it will help the faster the image. So where in single slice CT, where table, you can see this is table travel per rotation is divided by the nominal slice width. So if it is table travel is 10 mm, if it is slice width is a 5 mm, it means one this thing image. So where in multi-slice CT is pitch calculation is changed, where table travel per rotation, where it divided by the X-ray beam width. See now you see in the image uh, the x-axis and the d in the sense distance of the single slice. See, I'll give an example here. Now if it is one rotation, example 4 slice CT with each slice having a 5 mm of the width, 5 mm of the width means it will be nearly 20 mm X-ray, not nearly, it's a 20 mm X-ray beam which is rotating around the patient. One rotation when it takes, it will be 20 mm is covered. If it is single detector or a single slice means what is 5 mm. So that you can see this is here in the color blue, red, yellow, and green. So blue is one which is 5 mm, red is 5 mm, yellow is a 5 mm, and the green is a 5 mm. So it means 20. That's what how changed with the multi detector. So what is the image quality difference between the single slice, spiral single slice CT and the multi slice CT? So resolution where it is decreased in a single, noise, motion blur it is increased, noise is increased, partial volume is increased. Where you can see in the multi slice CT, resolution is increased, noise is decreased, motion blur is decreased, partial volume but artifact is increased. But anyway, nowadays we have a software, it can be problem can be shortcutted. So what are the advantages of the multi-slice CT? The short scan time, the production of overlapping images from single X-ray exposure, that's the benefit of that. And then reduction of radiation exposure, cardiac CT imaging is possible due to the multi-slice CT, improve accuracy in needle placement during the CT fluoroscopy, and multi-slice CT is 8 times faster than the single slice, where you can see the calculation which is given here. Improvement in the temporal resolution, improvement in spatial resolution, increased concentration of transvascular contrast media. That's because of that we are able to get a good image, good angiography CT, decreased image noise, and efficient X-ray tube utilization. So next we'll come to the detector technology. What is detector? The capture radiation beam from the patient converted to electrical signal, which are subsequently converted into binary code information for onwards transmit to the computer system for further processing. You will get the image. So what are the characteristics of the detectors? Most important, this might be a general, but most important, efficiency is one of the most important, because ability to get the capture, observed, and convert that X-ray photon into electric signal. If it is anything absorption or capturing, if it is missed, means you good image quality of the patient. That's then second one is the stability, where the refers to steadiness of the detector response. That stability of the detector should be accurate, that we will get the. Then another one is the response time. I think all of you might be studied about afterglow. So that is where in detector pile up will be there. So as the short of the this thing afterglow, that will be a response time will be a faster and will be a more. Next, the dynamic range, where a ratio of larger signal is measured to the precision of the smaller signal to the discriminant. Means, see, when you get the, see, when the information reach to the detector, might be small, might be large. It doesn't mean only collect the large signal and you will neglect the small signal. Sometimes small signal also is required. So this detector nowadays, detector we have, that is has a capability of collecting the accurate signals which is reaching to the detector. So how this works, you can see this in image. High voltage generator which is given to the X-ray tube. You can see here, from that then it will reach to the patient. When is in reach to the patient, here you can see this is the collimator second, and this is the first collimator. Then after that it will reach to the detector. Then after reaching the detector, it will see CT detector. It will convert to electronic signal. From the electronic signal, it will go to the CT detector system. Then again after that, it will convert to the binary coded information. Then it will create to the reached and it will convert to the visible image. So what are the different types? This all might be now a lot of advancement it is there, but basic what scintillation type or gas ionization, that remains same. That will never change, because that's the basic steps is how it is required. You can see in the image here where scintillation detector. So X-ray is reaching to the scintillator detector here. Then that it will X-rays will be converted to light photon, and light photon will be received by the PMT. Then it will convert to electric signal and it will create a image. So you can see this is the working principle of the PMT tube. Then what is the scintillator detector material is used? Crystal commonly used with multiple tubes includes calcium fluoride and bismuth germanate, where scintillator material is used with as a cadmium tungstate, and also some the rare earth material also used. You can see atria and gadolinium oxide ultrafast ceramic is which is scintillation material is used to nowadays, where the absorption efficiency will be 99 percentage. It means is a wonderful response of the detector. So another one is a gas ionization detector. Here also you can see X-ray which will hit to the xenon gas chamber, where it will convert the data acquisition to electric signal. Again, the electric signal it convert to the image. So what I think this during the third generation, this principle of ionization of this gas ionization detector only. So that's what is the advantages and disadvantages of the gas ionization detector. So advantages is excellent stability, fast response time, no afterglow, increased total detector efficiency around 50%, increased resolution, negligible lag time, highly directional to receive maximum primary beam. Whereas the disadvantages, quantum detector detection efficiency is less. Next, plug-in detector module came, where is an entire array of detectors is made of detector module. So each detector module plugs into the motherboard unit in the detection system. What is the advantage of this? So maintains the integrity of the detector system through easy testing and the replacement of the procedure. Means one single plug, if it is spoiled, it means we able to change it. We no need to change the entire detector. So later, where dual slice or dual row detector which is introduced, where dual row with the solid state detector array coupled with the special X-ray tube double dynamic focus system is used. What are the advantages of that? Excellent resolution due to the double fan beam ray intensity and detector sampling which is used. It means twin beam technology which was introduced in the dual slice method. Then multi row detector which is used. Multi detector are arranged in an array format that aids in acquisition multiple section of the object at a time. So what is the benefit of that? High volume coverage, high speed, reduced time for data collection. That was the then where multi-slice and multi-row detector, which is one detector with the rows of detector element, where solid state detector that can occur 4 slice per 360 degree rotation. Due to that, with a one rotation, you are able to get the 4 slice. So because multiple row of detector which is used in this, so that's why it will influence the slice thickness CT. You can see there are beam geometry or focal spot variates. You can see in the image where X-ray tube, uh, you You can see here when it's interact to the detector, you can see in the first one where conventional beam geometry with the single focal spot, single fan beam and single detector array arc was used. Where in multi, in the sense twin, when the twin is used, beam geometry from the who is invented that Ellison dynamic focal spot system which is used, that was the benefit. So that was told you how dual row and dual detector system. You can see here dual row, here dual detector system. Previously with the single detector array, there will be dual source of that. So here dual source and dual detector system which is introduced. Later matrix type of detector is used, where here single matrix which is detector is consist of 1.25 mm. So due to this, the resolution, the sharpness, all those things were increased, where you get a good contrast, good quality images. So you can see in this, you can see in the image where how this arrangement is made in the detector. You can see there are different slice thickness also able to use. The minimum slice thickness 1.25. If it is multiplied to 2 means 2.5. If it is multiplied to 4 times means more than 4 times 12 times means it will be 10 mm. So minimum slice thickness 1.25 able to take, or maximum slice thickness 10 mm was possible. So this was the benefit of the matrix or mosaic array detector which is used later. Then you can see here, see if it is using with the 1.25 slice thickness, because maximum is the this thing is a uh, mm, per rotation is the 4 images. So you can see here with the 4 images 1.25 mm detector, when we used to get a thinner section. When it is used with the one rotation with the 4 images with the 5 mm per slice, so it was able to cover with that with the larger area. So that was the benefit of the matrix array or matrix mosaic array. Later it is used the adaptive. In adaptive, what will happen, uh, the previous it was all the array, all the matrix was the same size, but in adaptive they changed the thickness of the um, detector with the 1 mm, sometime the other with 1.5 mm, the other with the 2.5 mm. So 1 mm if you want to take, the 1 mm detector will activate. When it's want to take a 2.5 mm with the will be activated. You can see in the image here adaptive array how it was arranged in the detector. You can see. So that's what how is it changed in the adaptive array detector. So here also the same thing how I explained in the previous slide, how the image technique, the detector, the slice thickness, all this thing is changed in the adaptive array detector. Then later we came with the hybrid, where similar pattern of the this thing, the previous adaptive array system is used, but here to instead of 2.5, thickness is used at the periphery, the center part which is used with the thinnest one. So that is what in where hybrid detector has composed elements that are not uniform size, but generally only a limited number of element size is used. This design has been especially popular on 16 channel CT scanner across all manufacturers. So this was the, at presently most of the places, most of the cities used with the hybrid detector technology. You can see here how the different type of different companies are which is used with the 64 slides, how it is. So later nowadays ultra fast ceramic is everywhere blooming everywhere. Everyone talks about ultra fast ceramics, the recent advance nowadays, where afterglow of the detector material decays to 400 times faster than the atrium gadolinium oxide that I told you in the scintillator detector time. So this is the reason why many of the companies which is utilized UFC, chemical reduction, which is this all technique which is used with this thing, ultra fast ceramics, because this is a hard yellow substance that it's like it looks like a plastic. So that's what benefit. And I said that rare earth element gadolinium, which is well combined with this material, includes sulfur and other additives, which is give increase the feasibility, increase the efficiency of the detector. So I told you in the during the seventh generation of the city flat panel detector, one of the current under investigation, excellent performance for the image of high contrast structure, high spatial resolution, where low contrast resolution of dose efficiency. However, it's I mean, but at presently it was well developed. Definitely, this thing have made in the flat panel detector. So that's what benefit in the next. We will go with the image artifacts in CT. I will be some of the part which is included means there are a lot of image artifacts is there in the imaging field, but I'll selected few of them where frequently what we see now every day when you do does the scan, that is the only part I'm included. Okay, as we'll move with the next slide. So what is the definition for the artifact? Then an artifact is a distortion or error in image that is unrelated to the subject being studied. It means something which is actually not required, it is present in the image where it is obstructing, it is unrelated to the image or unrelated to the diagnosis at all. So in addition to noise, artifact can degrade image quality and affect the perspectivity of the detail. So artifact can be appears in as a geometrical inconsistency, blurring, strikes, or inaccurate CT numbers. Equipment malfunctions such as tube arcing, electrical malfunctions, and detector malfunction produce artifacts on CT image. These are all certain different the reason where it will artifacts. So what are the source of the artifacts? Maybe due to the data formation, patient motion, polychromatic effects, equipment misalignment, faculty X-ray fault in X-ray source, data acquisition, profile sampling might be not accurate, angular sampling might be not accurate, or detector imbalance or scattered collimations, data processing might be something wrong, it is not using properly software, algorithm effects or anything. This is all the main source for the artifacts which is created image. So we will go with the patient motion artifact is the first, where is due to the patient's movement, what will happen? You can see in the image. You can see in the image where you can see here there are motion artifacts which is there in the patient's posterior fossa. Due to this, what all the information of the pons, midbrain, cerebellum, all those things, the information you lost it. So what are the this thing for the cause? The voluntary or involuntary motion. See, voluntary motion you can be controlled because you can ask you can explain properly to the patient not to move all those things and all. Involuntary movement means there will be without any unknowing to the patient. Example, eye movement, tongue, heart. This is all involuntary motion. So those movement you can use extra software where voluntary movements is there. You can do it yourself to protect or you can avoid such movement. So these are the where strike kind of lines which will appear in the image due to the miscalculation of the attenuation in the voxel. So that's why the artifact will appear. So what is the method for that? Already I told you. Reduce patient motion artifact includes patient immobilization, or if it is doing a heart scan and all, ECG gating can be used, or any correction algorithm software is available nowadays. Next is the metal artifacts. Here is completely, you can see when patient, especially female patient, when it comes to do the CT brain, if you are forgot to ask the patient to remove a earring, so that's time you can see this is the image where I kept in the slide. So due to that, there is the artifact created, streak kind of uh, artifact due to the metal artifact. So what you can do, you can ask the patient to remove metallic part with the in the suspected where required area, or nowadays we have a metal artifact reduction software that is available. See, if it is something patient comes with a fracture, that already they have implanted metallic rod in the fracture area, you cannot remove. That time you need to do the CT scan. So that time what you can use the metal artifact reduction you can use. So another one is the beam hardening artifacts. So that is usually it will be in the CT brain. If it is CT brain, it is usually in the posterior fossa. So you can see in the image where the streak kind of you can see this area, usually this area at the temporal at the mid ear area, where you can find always beam hardening artifact. You can see this is the line which is line here, which is present in this, is the beam hardening artifact. Because what will happen? So increase in a mean energy of polychromatic beam, which is X-ray beam in the CT, passes through in the object, where due to the thicker part of the other one area, when example, when the X-ray tube comes in this direction, so there will be a no thicker part in this area or in this area. So when X-ray tube comes in this direction, what will happen? These are the bone is very harder bone. Due to that, what will happen? That artifact it will create. So because of this, what will happen? CT number of certain structure is changed. These changes in a CT number result in a beam hardening artifact, which is appears as a broad dark band as a or as a is a streaks. I told you know here. This is the images. So due to that, you can see the due to that you get like a cupping kind of artifact. So what you can do, you can eliminate with the using nowadays you can using with the hardening correction software is available, or you can change the angulation of the tube. If you are taking in a helical scan, it is not possible. Sometimes if you are taking with the axial CT, you are able to take the you can change the angulation of the X-ray gantry. So partial volume artifact, that is usually it was frequently was facing the problem during single slice with the 4 slice CT and all, but nowadays we have a 64 128 slice CT is available, so that you will not face any such artifacts. You can see this is here. This is looks like some structure which is might be calcification or anything, but actually is a partial volume of the previous slice bone, previous slice image. So that is what you can with the partial artifact can be reduced with the, yeah, you can go with a thinner slice, or you can use a computer algorithm like volume artifact reduction techniques is available. Due to that also you can avoid this partial volume artifacts. So next one is this, stair step artifact. This is also same thing what I think. If you are not reconstructing, see now you are taking an image with the 2.5 slice thickness, later you will reconstruct to 1.25, and if you do uh, MPR or any other technique, post processing technique, you will not find this kind of stair step artifact. If you are straight away with the image thickness with the 5 mm, if you're doing reconstruction of that, means you will find this kind of artifact. So this is the how you can avoid it. I think you understand. So what is the pre and the post processing technique? This thing. So as a this reconstruction technique is used from Austrian mathematician Radon, where in 1917 he proved that reconstruction building is possible with the this with the. So what are the step takes place? So first step, it is a CT detector. When it is reached to the when comes to the before CT detector, pre-processing techniques is there. Then convention with the filter, where later it will be image reconstruction algorithm will take place. Then reconstruct the image of CT number. Then by the final image storage or display or recording or archiving, it is possible. These are the steps which will take after the reaching X-ray to the CT detector. So what are the types of this acquisition? Measurement data, raw data, convolutional data, and the image data. These are 4 different types of this thing. I'm not explaining this one. Please go through that the definition with the in the different available. So next is what is image reconstruction? Is the construction is the process of generating an image from a raw data or set of unprocessed measurement made by an image system. So what is the objective of this image reconstruction? Produce an accurate cross-sectional display on a linear coefficient of each element in the image matrix. Means there will be no information should be lost due to the image reconstruction. So that's what I think this already I explained you in the previous in the beginning itself only. This reconstruction takes place when composition of voxel, thickening of the voxel, and quality of the X-ray beam is involved to create the reconstruction technique. I say algorithms, where I told you already, this is a mathematical method for solving a problem where thousands of equations must be solved to determine the linear attenuation coefficient of all pixel in a image matrix, where it takes the finest steps to create the from the takes place from the seat number to create the algorithm. So what are the different algorithm, like back projection method, where is a summation method or linear superpositioning method which is used, where object is scanned from different directions, where image profile look like steps, but at the end at the back to the same number to create the back projection the method. You can see in the image here, there are different here you can see this is the X-ray here. This is the object. This is the object where X-rays will fall on the object. You can see this is the thinner part here, thicker part, and here thinner part. Because of that only, thinner part will be more absorption. Due to that, there will be darker area. There will be a slightly thinner part due to the slightly darker area. Where is the no objective at all? Here is the brighter area. The same thing when it rotates around this, where from all projections from the all direction with a superimposed, and it will be create a objective in the image. This is the create in the algorithm. So this is the how images. So you can see this is also you can see in the it's like a pattern, like a streak like pattern. So where you can see in the image it's like a caused like a blurring image, which is you can see in the image. That's what how it is created in the projection. So later the iterative method. Nowadays most of the methods are iterative method. There's a lot of advancement. All those things are there. So start with the assumption of the calculating method. So compress assumption with the measured values, make correction in bringing them into arrangement in the agreement, in the sense if it is any changes is there in between, means it will be corrected, and repeat the process over and over to bring it to the acceptable limit. That's what in the is used. So in the iterative method there are different types of there. simultaneously reconstruction, ray by ray corrections are there, point by point corrections are there. These are the three different, you can go through this. I'm not briefly explaining of this one. So these are different type of methods are available. So as comes to the post processing technique, which is developed in 1970 and 1980, in between this, where special software is developed, manipulated, analysis or visualization is done with the collecting data from the from the uh, information, and it is used application. So there are in this three-dimensional space is used, like width, height, and depth, represented by x, y, and z axis. Is total all the three angles is used to create a 3D image or 3D space. So that's what nowadays lot of this thing is available. You can see. So this is all interconnected, like input, workstation, and output. This is all done by the user. User means technologist, by us. We sit there and we do image devices, we pre-processing visualization or manipulation of the analysis, then display the devices, then we'll take a printer or a storage devices, what we do interpretation in between. This is done. So what are the different type of post-processing technique? The multi-directional projection of the images with the MPR, 3D imaging, in the 3D imaging, projection imaging like MIP or mini MIP, maximum intensity projection. So or and minimum intensity projection, it is, or surface rendering, volume rendering, and visual reality imaging, which is used. So what are the main important in this? The choice made for the post processing must be done carefully, so that to get a maximum utilization of the post processing data, where we will not lose any information when it. So multiplanar reconstruction, this is the first one method, where sagittal coronal oblique reformation is possible. You can see in the image with the Excel slice images, we will convert it to MPR, and as you can see, we most of the time frequently we use that to see the vessels with the thicker, the thin slice we will made it to. So what is the advantages of this? Enables visualization of specific structure in relation to surrounding structure, determines the extent of lesion or fractures, help to localize the lesion, bone fragment or foreign bodies. But what are the disadvantages of loss of image details? Because thinner slice, there will be more information. What we will do, we will, many images will be created to together as increase the thickness of it, and we will lose the information in between the images. So reformatting image quality depends on the Excel images that I already told you during the artifact. So plan of thickness due to that blurring or loss of structurality there. So next with the maximum intensity projection, MIP, where here you can see in the image the greater attenuation that I told you. Attenuation is related to the number of number CT number, where the high value that you can see in the display, with the 8 number is on in the out of this many, this number 8 is the maximum. So that maximum Hounsfield unit, that each mathematical ray of reconstruction encoded in is a display, means only maximum number of numbered value which is there, at that only will displays in the image. So make use of less than 30% of data in the 3D image, means maximum number is whatever the maximum number is there, only that data will be represented the 3D space. It means 10% only out of 100, 10% only has a maximum number will be created to create the to get the image. So what is the benefit of this? CT angiography, frequently we use this to see that take less time to produce 3D images with the VR. So what is the limitation of this? The presence of high attenuating object may be obstacle the valuation evaluation. Means only high number is which is taken, the lower number is rejected. That's why we maybe loss of the image, lack of depth and the inability to show superimposed structure. Because I told you that is because higher number only is selected, lower number is rejected. That's the reason we will be has the limitation of the in the this. Next is a mini intensity projection. Only tissue with the opposite to MIP, lowest Hounsfield unit will be displayed. So in the image, usually it is used for lung imaging, sometimes abdomen to see the fat. This thing we use this imaging. What is the disadvantage of this overlapping structure? Is a lack of a real 3D relationship. We will not get the real 3D relationship of the images that you can see in the compare with the right and left. Here with the three mini map, here with the other method where we will chance how you can see the difference between two, how we will lost. So next one is surface shaded display, where a surface shaded display is a surface rendering image that provides a realistically looking three-dimensional view of the surface. So it's like the depth perception, means all the shadowing voxel enhanced in you can see uh, here range of HU means that's kept some threshold range corresponding to the particular structure is selected. Now here you can see 4 and 5 displayed surface is where sorry 6 and 6 to 9 threshold range we kept 6 to 9. So those range only subvoxel surface are selected and creating a image. This is here also same thing, only 10% of original selected and creating the image. You can see this is the image how it formed with the surface render. So what is the advantages of this? Clarity in display of image, smoothness of you know, usually it is soft tissue. If you wanted to see the soft tissue and all, we will use this post processing technique. Less time is required. The vessel structure can be seen, but only disadvantage is removes all the data. I told you 10% only is takes, remaining it to be rejected. That's the reason. So internal structure and all it will be not. That is what problem. So volume rendering is the another method VR we call. Volume rendering technique is enables edge enhanced visualization from an extra luminal perspective or endoscopic perspective volume rendering of body cavity or hollow viscera. This all according to the attenuation value assigns color or opposite to different. You can see here, see the how MIP image is reconstructed from the same volume data shows all of the vessels. It means you can see due to this volume rendering technique where this is the you can see MIP reconstruction technique where it is used. Due to this, what will happen? The individual vessels will be differentiated. That is what the best technique in the VR. It means we able to see only blood vessels or bone, high bony structure, density bony structure able to see. You can see in the image here, we able to see any fracture or anything bony if it is required. Only if it is done a cardiac scan means we able to see properly the vessels of the uh, heart. So these are the comparison with the surface rendering, MIP and volume rendering. You can see depiction of 3D relationship where in good in surface rendering, in MIP it will be fair and volume rendering will be good. So where in edge delineation where good in surface rendering, good in MIP, when volume rendering will be a fair. You can note down this thing. I'll give just a second for to read this and you can see. At the same time, the other you can see in the at the fifth line, percentage of the data used where surface rendering MIP is very less. Due to that, we have chances of missing of the information. Where in volume rendering it will be up to 100%. So that's why the quality imaging accuracy will be good. So what is the computational cost in the sense where low in surface rendering and MIP and volume rendering will be a high. So this all point you please note down. It is very useful for you people. So virtual scleroscopy, I think all of you at the CT. There are two different virtual types are there. One is a fly through technique, another one is navigation technique. So both are, see, when you acquire the image, the same technique. There will be no separate technique for fly through or navigation. After acquiring image and during a post processing, you can change through fly through or to the navigation technique. Where in navigation technique you can guide the user anatomy. Like you particularly you can go to that area and you can see that where exactly polyp or lesion or mass lesion is there. You can, and fly through technique is like scenic. So that's how it is in the in this. So these are the different technique between this virtual bronchoscopy and real bronchoscopy. Where virtual bronchoscopy, endoluminal and extraluminal you can able to see. The other one only luminal you can see in a real bronchoscopy. Where in virtual bronchoscopy means CT bronchoscopy, where many quantitative measurement can be taken, but in that real bronchoscopy it is not possible. Where in reduction complication like infection or perfection is non-invasive, because live it is not live in virtual bronchoscopy, where it is possible in the real bronchoscopy, wherein multiple simultaneous view can be seen in the virtual bronchoscopy, where in real bronchoscopy it's only like it's a 2D, it's not a 3D. That is what. Then no information on mucosa surface, where in real bronchoscopy it is possible to see, that is. So that is what benefit within these two. Where in real bronchoscopy is real time, where in virtual bronchoscopy it is not real. So these are different. It's not a post-processing technique. This is all extra software which is available in the. We will think that this is the post-processing technique. You can see that curved planar image. Something. See now here in the image you can see these are the arteries are there in the heart. You wanted to see the full length of the artery in one image itself. That is, it is possible with the curved planar imaging. So that is what benefit with the curved planar. Then advanced vessel analysis, you can see that vascular analysis like a stent placed, anything is placed means balloon, catheter or anything is placed means you are able to see. So that is what best another process. Then perfusion technique, I think all of you well aware of this perfusion. Then lung nodule assessment, this is also another software which is available. This is all recent and developed, where what I'm telling. Lung density, you can see, compare the lung density with the right and left, upper lobe, lower lobe, and these are the well benefit for the suspected indication. Then comprehensive cardiac analysis is possible. Calcium scoring, one of the advanced technique which is helpful to score the calcium scoring, that is functional CT is possible. How we do in functional MRI, the functional CT is possible. So bone mineral density is possible with the post processing. Liver analysis is possible, which is you can see the different functional of the liver in the different, that is possible. Fat assessment nowadays, this is one of the important post processing technique in everywhere, because fat is one of the commonest factor in the human body. So dental planning now, due to the cone beam CT and all, dental planning is very less during the CT during the CT and all, because they have dental equipment itself really well developed. They have a dental cone beam CT is there. Due to that, dental planning is available. The same time, almost I'm ending with the coming to the closer to the end of my session. Layout of CT room. Till now you might be familiar with the principle of the CT, techniques of the CT. This all you are come to know. The same time, layout of CT room also is one of the important topic. When CT is newly installed, if you are appointed as a manager, if you are appointed as a in charge of the department, that time you should know layout of the city. So where supposed to be there? It's supposed to be in the ground floor or minus. Minus means underfloor. So supposed to be kept, because to avoid any unnecessary exposure to the grounder level. So that's the reason should be usually means if you kept it in the first floor or the second floor, you need to protect all the area. Shielding is supposed to be all the 360 direction. That's why if you're kept it a ground floor, lowest one, so grounder floor you no need to worry about. You need to worry about the other directions. So where pediatric or maternity ward is there means you should not be installed in that area. You should be away from the. So what are the large room with the enough space is required to accommodate the CT scanner, all other material which is required for the equipment is required to run this CT room, like injector, any emergency bed, any disposable material container, all that's able to keep, and as well as the dressing room also supposed to be kept. So other space what is required? Console room, well console room with a large window, able to see the whole the room of the CT. Then patient preparation room supposed to be there, patient waiting area supposed to be there, and reporting room. If it is closer to the workstation is well and good. So if that means there will be a lot of benefits are there, time, unnecessary exposure, contrast, the many factors which is affects with the, if it is closer to, if it is closer to is there means we can avoid that workstation. If a workstation is closer to the console room means we can avoid the such things. Then film printing and or laser supposed to be kept. So what is the area is required? To 25 meter square area is minimum is required to install the CT, and single dimension supposed to be a minimum 4 meter. The single dimension means this area. This area supposed to be a minimum should be 4 meter. It should be more than that. It should not be less than that. If it is less than that means or this wing they will not give a permission to run the CT equipment. So ceiling height same way. Ceiling height should be above the 9 feet. That is what, so you can see here. This is a layout proposed by the our Indian organization, where you can see this is the isocentric area, where from here to the wall the distance supposed to be 7.2, yes, 7.2 is the feet supposed to be kept the minimum distance. So that is the from the iso center. So the same way you can see the from the other end of the iso center to the other wall also supposed to be 6 to 10 feet supposed to be the distance we should be kept. That is which is recommended by the if it is this distance is maintained means there will be a installation is possible, and you can avoid unnecessary exposure to the neighbor room. So this is sometime what will happen if the room is not possible with the accommodating, because previously image you might be seeing that how the layout present. So if it is this room here in this image, if it is all the rooms are in equal distance, you can keep it isolation from the ISO center to the distance of this is can be maximized. If it is, if you CT gantry is kept in this direction, if it is, this is the gantry, if it is in this direction from the ISO center to the wall, the distance will be shorter. So to avoid you can use this this is the method you can use it. So what are the radiation shielding is required if you are using the computed tomography? You can see here from whatever the distance I already told you, this should be from the ISO center of the gantry of the CT equipment. So if you are using with the shielding material with the bricks, it should be a is 27 um, centimeter. If it is if you are using a steel 2.7 centimeter, if the distance 1.5 centimeter from the ISO center, if the distance is 1.5 centimeter to the wall means bricks if you are using means 27 centimeter of the wall thickness should be there. If it is ISO center is 3 meter away from the wall means, then you can use the bricks can be a lesser thickness means 20 you can use. So that is the benefit Okay, so that's the most important part. This one you should know very well about it. So these are the reference book. You can go computer tomography, physical principle, clinical application, and quality control, which is CRAM. We shortly we call author name. So also Bushong is so both are well known in well known book in the radiology field. If you refer this both book, it is more than enough to understand the CT, about the CT principle and CT generation advanced technique. So at the end, thank you so much for the listening my talk till now. I'm hoping that you understood the concept of CT principle, concept of generation, concept of the multi slice, single slice,